There's a lot of talk right now about a possible link between Tylenol use during pregnancy and the risk of autism in children. So, let's break down what's happening, what we know, what you should keep in mind if you're expecting. You might have seen headlines recently. The Wall Street Journal HHS may soon release a report suggesting a potential connection between taking Tylenol acetaminophen during pregnancy and the development of autism. Now that's a big claim, and it has a lot of people worried. But before you panic or make any changes, let's look at the facts. First, the report isn't out yet. HHS hasn't confirmed what's in it. They're saying that any claims about its findings are just speculation at this point. They've promised that their report will use gold standard science, but until it's officially released, there's really no way to know what conclusions they'll draw. So, what does the existing science say? It's actually pretty mixed. Earlier this year, researchers at Mount Sinai in New York published a study suggesting that prenatal exposure to acetaminophen might raise the risk of neurodevelopmental disorders, including autism. But last year, another study published in JAMA found no link at all. In other words, the experts themselves don't agree. The company that owns Tylenol, Kenvue, says their own review of the science hasn't found a causal relationship between acetaminophen and autism. They point out that Tylenol has been recommended and used for decades, especially when managing pain fever during pregnancy. And pain and fever, by the way, can also pose risks to both the mom and the developing baby if left untreated. So what are doctors saying? The American College of Obstetricians and Gynecologists still considers Tylenol to be safe for use during pregnancy, as long as you follow the directions and don't exceed recommended doses. And that's a really important point. Never take more than what's advised by your doctor or on the label. If you're pregnant or planning to be, here's what I'd recommend. First, talk with your doctor before making any changes to your medication routine. Don't stop taking something you need, like Tylenol for pain fever, without medical advice. And remember, this is only a potential link, not proof of a cause. There's a big difference. Researchers are still digging into all the possible factors that contribute to autism, and there's no single answer yet. As more information comes out, I'll keep you updated on what the science actually says, not just what the headlines claim. Stay informed. Ask questions and always put your health and your baby's health first. If you want to stay on top of breaking news like this, make sure to subscribe and turn on notifications. Thanks for watching.